Most people never think about their prostate until there's a problem. But what if I told you that one of the most common private daily habits, masturbation, could be influencing the health of your prostate in ways that science is only just beginning to understand? This isn't just about pleasure or taboo. This is about biology. It's about longevity. It's about understanding the mechanisms that either protect or degrade a key part of male health. One of the most significant findings in recent health research is the link between regular ejaculation and a reduced risk of prostate cancer. This connection is based on large-scale studies, including a widely cited one conducted by researchers at Harvard, which followed over 30 men over an extended period. The data showed that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who did so less frequently. This statistic has shifted the conversation around male reproductive health, particularly in how everyday behaviors like masturbation may have a long-term impact on the function and health of the prostate gland. The biological reasoning behind this correlation lies in the way the prostate functions. The prostate is responsible for producing the fluid that nourishes and transports sperm. Over time, if this fluid is not regularly cleared through ejaculation, it may accumulate waste products, inflammatory compounds, or other substances that can potentially lead to cellular stress or genetic mutations within the gland. This accumulation may create an environment more conducive to cancerous changes. By regularly ejaculating, the prostate is essentially flushed out, helping to maintain a cleaner, less inflammatory internal environment. There is also evidence suggesting that regular sexual activity, including masturbation, may help regulate hormone levels that influence prostate health. For example, testosterone and its more active form, dihydrotestosterone DHT, have been linked to prostate growth and, in some cases, cancer. A balanced hormonal environment is critical, and regular ejaculation may help keep hormone levels in check by reducing the prolonged buildup of certain androgens in prostate tissue. Another mechanism to consider is the improvement in blood flow and circulation in the pelvic region that occurs with arousal and ejaculation. Good blood flow helps deliver oxygen and nutrients while removing metabolic waste, which further contributes to cellular health and resilience. This kind of physiological housekeeping may seem minor, but over months and years, it can make a significant difference. It's important to note that this doesn't mean more is always better. The protective benefit appears most consistent within a range of 20 to 21 ejaculations per month, suggesting a threshold rather than an endless benefit. Beyond that, factors like overall health, sleep, nutrition, and mental well-being also play major roles in prostate function and disease prevention. Still, this key point emphasizes that one of the body's most basic functions may be serving a much more protective role than previously understood, making regular ejaculation a potentially important part of a long-term male health strategy. Dopamine plays a central role in motivation, reward, and behavior regulation, and its involvement in sexual activity is well documented. During masturbation, especially when it involves visual or mental stimulation, such as pornography, the brain releases large amounts of dopamine, creating a powerful sense of pleasure and satisfaction. However, when this becomes a daily or compulsive habit, particularly with the use of high-stimulation content, the brain can start to adapt to these elevated dopamine levels by reducing the number or sensitivity of dopamine receptors. This phenomenon is known as dopamine desensitization, and it can have significant effects on both mental health and sexual function. When dopamine receptors become less responsive, it takes more stimulation to achieve the same level of satisfaction. In the context of daily masturbation, this can lead to an escalating cycle where a person needs more intense or frequent stimulation just to feel normal. Over time, natural sources of pleasure such as social interaction, exercise, or even real life intimacy may begin to feel dull or unsatisfying. This is not due to a change in values or desires, but is rooted in the way the brain's reward system has been rewired by overstimulation. The individual may start to lose interest in everyday tasks, struggle with focus and drive, and even experience symptoms similar to depression. This same desensitization can also interfere with sexual performance. When the brain becomes reliant on artificial sources of stimulation, real life sexual experiences may not trigger the same level of arousal or satisfaction. This disconnect can lead to issues like delayed ejaculation, difficulty maintaining arousal, or even erectile dysfunction. The problem is not located in the reproductive organs themselves, but in the brain's circuitry that regulates arousal and pleasure. This is why even young men with no physiological issues can experience significant sexual dysfunction purely as a result of chronic overstimulation and dopamine imbalance. Another concern is that as natural dopamine levels drop and the brain becomes less sensitive, the prefrontal cortex, which is responsible for decision making, impulse control, and self-regulation, can begin to lose its ability to moderate behavior. This leads to compulsive patterns where individuals continue engaging in the behavior despite knowing it might be harming their mental or physical health. Over time, this can have a cascading effect on other areas of life, including sleep, productivity, mood, and relationships. Understanding this neural mechanism is critical. It highlights that the issue is not the act of masturbation itself, but rather the way the brain adapts to repeated, high-intensity stimulation. Restoring balance requires awareness, intentional behavioral changes, and in some cases, temporary abstinence to reset the brain's sensitivity to natural rewards. When considering the effects of daily masturbation, it's essential to look beyond just how often it occurs and instead examine the context and intent behind the behavior. The same action can have very different outcomes depending on the mental state, emotional drivers, and setting in which it takes place. Frequency alone does not determine whether masturbation is healthy or harmful. It's how the brain interprets and responds to the behavior that truly matters. When practiced intentionally in a calm and mindful state, masturbation can serve as a form of stress relief, support hormonal balance, and promote a healthy relationship with one's body. However, when done compulsively, often as a reaction to boredom, stress, anxiety, or the constant availability of high-stimulation content, the same behavior can lead to long-term issues in both mental and physical health. Neuroscience shows that the brain's reward system is highly responsive to both novelty and repetition. When masturbation is paired with extreme novelty, such as frequent pornography use, the brain starts associating arousal exclusively with artificial stimulation. Over time, this rewiring can cause natural, real-world intimacy to feel less stimulating, which may interfere with personal relationships and emotional connection. Additionally, this kind of overstimulation bypasses the slower, more fulfilling forms of dopamine reward that come from real interaction, goal achievement, or physical intimacy. The result is a brain that becomes conditioned to expect quick, high-intensity rewards without effort or emotional depth. Intent also plays a crucial role in how the body processes the experience. When the behavior is approached mindfully, with an awareness of physical sensations, emotional state, and without rushing, it tends to have a calming, parasympathetic effect. This kind of intentional self-connection may actually promote hormonal balance and stress reduction. In contrast, when masturbation is rushed, compulsive, or used as an escape, it activates more of the sympathetic nervous system, the body's stress response and may leave a person feeling more depleted, anxious, or emotionally disconnected afterward. Another aspect of context is timing and environment. Masturbating late at night, especially after hours of screen exposure or while emotionally dysregulated, can negatively impact sleep patterns, circadian rhythm, and overall mental clarity. On the other hand, engaging in the behavior at a time when the body is relaxed, in a low-stimulus environment, may allow for better physiological recovery and mood regulation. Ultimately, the key to understanding the health impact of masturbation lies in the intention behind it. When performed as a conscious, regulated behavior, it can be part of a healthy lifestyle. When it becomes a compulsive or emotionally driven escape, it can gradually erode motivation, performance, and overall well-being. The human nervous system is intricately involved in every aspect of sexual function, including arousal, ejaculation, and recovery. This system is divided into two main branches: the sympathetic nervous system, which handles stress responses and stimulation, and the parasympathetic nervous system, which governs rest, relaxation, and recovery. During sexual activity, both systems play roles, but when ejaculation happens frequently without adequate recovery or emotional connection, the sympathetic branch tends to dominate. This constant activation can lead to overstimulation, creating a state of chronic tension in the pelvic region, especially in the muscles surrounding the prostate. Over time, this kind of physiological pattern can contribute to conditions like chronic pelvic pain syndrome or non-bacterial prostatitis. These conditions often present as discomfort, pressure, or pain in the lower abdomen, groin, or perineum. And while they may not show signs of infection, they are strongly linked to muscular and nervous system imbalance. Daily masturbation, particularly when it's rushed, forced, or habitual, can reinforce this imbalance by not giving the body time to reset and shift back into a relaxed, parasympathetic state. The result is a subtle but chronic stress state centered in the pelvic area, which may influence prostate health negatively. Additionally, ejaculation requires a coordinated effort between muscles, nerves, and blood vessels. When this process is triggered repeatedly without allowing the body to fully return to baseline, it can cause fatigue in the pelvic floor muscles. This ongoing muscle tension and fatigue may reduce blood flow and lymphatic drainage in the area, leading to stagnation, inflammation, or discomfort over time. Since the prostate is highly vascular and sits directly in this region, its health can be affected by these changes in circulation and muscular tone. Furthermore, the body's hormonal response to frequent sympathetic nervous system activation includes the release of stress hormones like cortisol. Elevated cortisol, especially when sustained over time, is known to increase inflammation throughout the body, including the reproductive organs. Inflammation is a key contributor to a variety of prostate issues, from benign prostatic hyperplasia to more serious concerns like chronic prostatitis. Even if these issues don't manifest immediately, the slow buildup of stress responses in the body can influence prostate function and overall reproductive health. Maintaining a healthy nervous system balance is essential, especially in behaviors tied to arousal and ejaculation. Alternating periods of stimulation with proper recovery, rest, and relaxation is crucial. Daily ejaculation without mindfulness or sufficient rest may shift the nervous system into a prolonged stress state, making the pelvic region, including the prostate, more susceptible to tension, poor circulation, and low-grade inflammation that accumulates over time. Masturbation, when practiced in a balanced and intentional way, can actually support several aspects of male health, including the well-being of the prostate. While excessive or compulsive masturbation may lead to negative consequences, Moderate and mindful engagement with one's sexual health can have several physiological and psychological benefits. The act of ejaculation helps to maintain regular function in the reproductive system, including the clearing out of old prostatic fluid, which may help prevent the buildup of inflammatory compounds within the gland. This simple yet important maintenance process supports the idea that regular release may serve as a protective mechanism against certain prostate issues over time. Engaging in masturbation also helps regulate testosterone levels and supports hormonal balance. Contrary to popular belief, ejaculation does not deplete testosterone long-term. Instead, the release of testosterone and other neurochemicals associated with arousal can actually help maintain hormonal rhythm and overall endocrine health. When done in moderation, masturbation may support mood regulation by triggering the release of oxytocin, prolactin, and endorphins, chemicals that reduce stress and promote relaxation. These neurochemical responses create a feedback loop that not only helps manage anxiety, but also improves sleep and recovery, which are both critical for prostate and general health. From a physiological perspective, regular sexual activity improves blood flow to the pelvic region, which includes the prostate. Good circulation ensures that oxygen and nutrients are delivered efficiently, while waste products and toxins are removed more effectively. This vascular activity also helps maintain the tone and responsiveness of the tissues surrounding the prostate, contributing to better function and reduced risk of dysfunction. Like many other areas of the body, the prostate benefits from consistent moderate use. It's similar to exercising a muscle, not too much, not too little, but just enough to keep it active and healthy. Mental and emotional health also play a significant role in overall prostate wellness. Mindful masturbation, done with awareness rather than compulsion, allows men to connect with their bodies and relieve stress in a safe, private, and controlled way. This self-awareness fosters better emotional regulation and can lead to healthier relationships with sexuality and self-esteem. When combined with a lifestyle that includes adequate sleep, a nutritious diet, physical activity, and limited screen stimulation, masturbation can be part of a larger strategy for sustaining prostate function and preventing issues like chronic inflammation or dysfunction later in life. Ultimately, when practiced in balance and with awareness, masturbation can be a natural and healthy aspect of a man's routine. It supports not only sexual health, but also the broader systems that influence mood, hormonal regulation, and long-term prostate well-being. Understanding the relationship between behavior and biology is essential, especially when it comes to personal habits that are repeated daily. Masturbation, like many other behaviors, may seem insignificant in the moment, but its cumulative effects over time can influence the brain, hormones, and overall health. The nervous system, hormonal balance, and organ function all respond to patterns, not isolated events. This means that a habit repeated consistently, even if it feels harmless, can shape how the body functions and adapts. In the case of masturbation, the long-term outcomes depend less on the act itself and more on the regularity, intention, and emotional state surrounding it. What many people overlook is that these biological systems are highly adaptable, constantly responding to the inputs we give them through behavior. The brain, particularly its reward circuitry, adapts to repeated patterns of stimulation. When those patterns are balanced, intentional, and aligned with natural rhythms, they can strengthen healthy neural pathways. However, if the behavior becomes compulsive, disconnected, or rooted in emotional avoidance, those same pathways can become dysfunctional. This can manifest as reduced motivation, increased stress, and even sexual dysfunction, not because the body is broken, but because it's adapting to a distorted stimulus loop. Just like overtraining a muscle can lead to injury, Overstimulating the brain's reward system through excessive masturbation or artificial stimulation can lead to desensitization and imbalances in neurotransmitter function, especially dopamine. Hormones also play a vital role in this equation. Testosterone, cortisol, dopamine, and oxytocin are all influenced by sexual activity, and the way these hormones cycle and interact can be disrupted by repetitive or compulsive behavior. Over time, these shifts can affect mood, energy levels, recovery, and even immune function. The body is not isolated in compartments. Everything is interconnected. What you do repeatedly sends a message to your biological systems about what to prioritize and adapt to. That's why understanding the why behind a behavior is just as important as understanding the what. When people approach masturbation with mindfulness, intention, and self-awareness, it becomes a conscious practice that aligns with healthy biological function. But when it becomes automatic or emotionally driven, it can lead to imbalances that ripple across the entire system. By becoming aware of how behaviors shape biology, individuals gain the power to make informed choices that support both mental and physical health. This awareness leads to greater self-regulation, stronger motivation, and better overall well-being. The key insight is that the body and brain respond to repeated behaviors, and each small daily decision adds up over time, shaping long-term outcomes in ways that are often invisible until they become either a strength or a problem.